Nelson's dictionary defines probing as an exploration or an investigation. Probing is used in the counseling role to encourage the client to tell his story. Probing moves the helping process along, clarifying and expanding upon what the client is disclosing. It can also help him to focus in a specific area. Probing is one of the most useful counseling skills. Probing can be verbal, for example, asking a question, or nonverbal, for example, leaning forward. Egan describes brief verbal and nonverbal probes as prompts. For example, a short verbal response such as yes or I see encourages the client to continue with his story. While there are other forms of probes, such as statements and requests, this program will focus on probes which are in the form of questions. Asking questions is perhaps the most common type of probe which nurses use, often even excessively. In the counseling role, careful thought and skill are needed to ensure that the appropriate type of question is asked for the appropriate reason. You will need to find out information about the client, but will also use questions to influence the direction of the conversation. A word of caution. Questions center the control within the nurse more so than in the client. Reflecting, making statements or paraphrasing, for example, are less invasive. In asking questions, the nurse is directing the conversation to areas he thinks are worthwhile to explore. That is why the use of questions must be judicious. What types of questions are there, and which are best to use for what situations? Cully and also Bernard give a comprehensive list. First of all, there are closed questions, which generally elicit a brief response from the client. Let's look at a possible response from a closed question.
Do you find that you still feel depressed?
No, not really.
The client responds quite briefly. Sometimes clients will answer yes or no. In any event, there is no elaboration of the story. As well, if the nurse overuses closed questions, the interaction with the client is less a conversation and more like an interrogation. The nurse also leads the conversation with the client, assuming a more passive role. Closed questions do have a place, however. When the nurse wants specific information or to clarify a situation, closed questions are useful. There is another type of question which is most useful in counseling because it encourages the client to further elaborate on his story. It can be particularly helpful in initiating a conversation. This type of question is an open question. You can not only obtain information with an open question, but you can also encourage the client to be actively involved in the conversation. Let's return to the same client that you saw previously and ask an open question.
How are you feeling?
Well, I'm starting to feel different than a few weeks ago. Not quite as down as before.
What's different now?
Well, I guess one of the big differences is that I'm starting to see the situation differently. Before I thought that if only I worked hard enough I could make the relationship work. Now I see that it takes two people, that she has to put forth the effort.
Note that the client gives a much fuller response and moves deeper into aspects of his story. He is doing most of the talking as opposed to the nurse, and is obviously at ease with the nurse. Note also that these two questions begin with different words, how and what. Open questions generally begin with how, what, when, who, or where. How questions encourage the client to give his perspective on the situation.